Hi, everybody. I'm Dr. Reller, your Family and Obesity Medicine Board Certified Physician. I just wanted to come on here today to talk to you about how to take your blood pressure at home. Okay, just sharing my screen. So why is it important to take your blood pressure at home? Home blood pressure monitoring provides important diagnostic information beyond the in-office blood pressure readings. It's practical and accessible. It can result in lower blood pressure readings than in-office readings. It can confirm the diagnosis of hypertension or high blood pressure after an elevated blood pressure reading in the office. It can help us identify those patients with white coat hypertension, which I'll describe more in a minute. And it also can help us make better decisions on how we can adjust your blood pressure medications. So what is white coat hypertension? White coat hypertension is when your blood pressure is elevated in the office, but normal at home. Some people are just more anxious in the office. They're afraid of the white coat, which is why I don't wear one. And it can be dangerous because it can lead us to wanting to provide medication for you, but it may not actually be indicated. And therefore, your blood pressure become too low and it may lead to lightheadedness and even a fall. So, what kind of device should you use to take your blood pressure at home? You want to make sure it is a validated and fully automated blood pressure device that stores measurements. You can go to www.validatebp.org and see a list of appropriate blood pressure devices there. The one that I'm going to use today is the Beat blood pressure cuff given by the Coach Care providers in the home blood pressure monitoring program that we run. So what cuff? You will need an appropriately sized arm cuff. You'll be measuring your arm circumference at the midpoint of the upper arm. The bladder length should be 75 to 100% of the arm circumference. That would be this part. The bladder width should be 37 to 50% of the arm circumference. So that's when it's all folded up. And you should be able to fit 2 fingers between your arm and the cuff when you are taking the measurement. Technique for accurate readings. Now, this is super important. You want to avoid physical activity, caffeine, or other stimulants 30 minutes prior to testing. You want to make sure you've gone to the bathroom. You want to rest quietly and avoid talking and texting for at least 5 minutes. The cuff should be placed tautly on your bare arm, if possible, about 1 inch above the elbow, with the center of the cuff, which typically has an inscription by the manufacturer, over the brachial artery. You want to place your palm up. You want to make sure the tube is not kinked. During the measurement, you want to continue to avoid talking and texting and sit with your back supported, legs uncrossed, feet flat on the floor, and arm resting on a flat surface with the cuff at heart level. It looks like this, and I'll show you an example of me doing it in a little bit. What is my blood pressure goal? So typically your goal is less than 140 over 90 millimeters of mercury. Normal blood pressure is less than 120 over 80 millimeters of mercury. Sometimes your doctor may tell you that your goal can be less than 150 over 90, and that is usually for patients above 60 years old. There are some cases when your doctor or specialist, such as your nephrologist or kidney doctor, will want your blood pressure to be less than 130 over 90. Please reach out to your doctor if you're unsure of your blood pressure goal. What if your blood pressure is not at goal? If your blood pressure is not at goal when you take it, repeat the blood pressure again after at least 1 minute. If it's still not at goal, wait 30 to 60 minutes and repeat it again. If it is on average above goal, your doctor may want to make adjustments of your medication. So always bring your blood pressure log with you to each visit with the doctor. If your blood pressure is greater than 180 or 120, that's an emergency. It can be dependent upon if you're having any symptoms or not. But first, rest and repeat your blood pressure to see if it comes down on its own. And then you're probably going to want to reach out to your doctor or the ER. Wrist cuffs. So quick thing about wrist cuffs is they're just not very accurate. They have significant limitations that decrease this accuracy. And so I typically do not recommend them. Blood pressure kiosks. So sometimes people may just not be able to afford a blood pressure cuff, or we're not really sure if it's worth the investment yet. So I do tend to tell people it's okay to go check it in the pharmacy or grocery store, but really they're not near as good as home blood pressure monitoring. You're not going to get that good quiet room. You're not going to be fully rested. And some of them aren't even validated by standard protocols. And there is limited data on the reproducibility of their readings. Some even have inadequate back support, and the single cuff size is often too small for many adults. However, if it's all we have, sometimes I say use it anyway. The cost of the blood pressure device. So out of pocket, they can be from $37 to $100. The ones that run in our office are about $75. Many flexible spending accounts can be used to reimburse you, or some even public employment plans may cover the monitor, but it very much varies by state and by plan. And usually only if the hypertension is diagnosed. Medicare Part B does not cover blood pressure device, but it does cover something called ambulatory blood pressure monitoring, which is a little bit different than what I'm doing in my program. It does also cover remote patient monitoring, which is what we do. And these are my references. So here, now I'm going to stop sharing. And I'm going to try to take my blood pressure, well, at least set it up for you. Okay, so I'm going to scoot this back so you can get a better view. Okay, so first we talked about measuring your blood pressure, or measuring your arm. So I got a little measuring thing, and you're supposed to measure the middle of your arm. So I'm going to show you that. Okay. So mine reads about 27 centimeters, okay? And the blood pressure cuff that I have shows that it's 22 to 40 centimeters in circumference. So it's a good size for me, okay? If you're on a remote patient monitoring program, be aware that we do have larger cuff sizes if needed, okay? Then you want to open the cuff, read the directions. So when it's a personal cuff, the directions are facing you so you can read them, okay? So you put your arm in. You want to have it about an inch above the antecubital fossa, or your elbow, really. And then you want to make sure that the little artery mark, I don't know if you can see that, right here, lines up with your brachial artery. Okay, you want to make sure the tube isn't kinked. You want to make sure you can have 2 fingers beneath the cuff in your arm. And then I never took forward, but let me push this back. So you want your feet flat on the floor. Just push this down a little bit. Your arm, your palm face up at the level of the heart. Okay, so like this, the arm at the level of the heart. My feet are going to be flat on the floor. My legs are uncrossed. My back is against the surface. I'm relaxing. Let's pretend I wasn't talking or texting. So I would push start on my machine and continue not to talk or text and patiently wait for my blood pressure to be taken. If it's elevated or above 140/90, I might want to repeat that within a minute. I want to make sure that all the blood flows back into my arm. So we typically recommend at least 1 minute of pause in between. If it's really high, I would probably repeat it in 30 to 60 minutes again throughout doing the whole process. Okay. So I'm not going to make you sit here while I take my blood pressure, but I think you get the idea. So arm flat on a table, level at the heart, resting, talking, legs uncrossed. Okay. And that is what I have for you today. So I hope you enjoyed this video. Please share it with your friends and family if they need any help taking their blood pressure at home. And look back in the future for any more videos that we may be posting. Thank you. Have an awesome day.